Women matter. It is within our collective power to make the future promising. Good nutrition for women is also foundational for families, communities, and nations.
Today, 1 in 3 women of reproductive age suffer from anemia worldwide. Prior to the COVID-19 pandemic, no country was on track to meet the World Health Assembly anemia target. The pandemic is projected to increase maternal anemia levels by nearly 5 million by 2022.
Women's nutrition is not just a matter of poverty, it is also an issue of equity. Millions of women eat last and least in quantity and in quality of foods. For most, this does not change during pregnancy.
Our failure to invest in women is robbing women, society, and our collective futures of full potential. Yet we know what to do. Nutrition can dramatically improve health, education, and incomes of women and unleash billions of dollars of untapped lifetime earnings.
Decades of limited progress requires a bold path and a common agenda on women's nutrition. Health and equity go hand in hand. It will take all of us to come together to drive sustainable investments, actions, partnerships, and progress. We can change the story, but we must act now.
Everyone, this is Gerda Verburg speaking. I'm the coordinator of the Scaling Up Nutrition Movement, and I'm very proud after this very empowering video to announce that I will be your moderator for the next 1.5 hours. This event is part of the Nutrition for Growth Summit, the summit that will about conclude a year of action on nutrition and is hosted by the government of Japan. And it follows in a very logic way the UN Food System Summit, where nutritious and healthy food was emphasized very strongly. It's following COP26, where food and healthy diets and the impact of climate on nutrition is touched upon, but need to be done further. And N4G is bringing a lot of things together. And it has taken a while, but the energy is going up. And especially the nutrition for women is crucial, but also powering women to be the agents of change, not only carrying forward the burden and the plate and the responsibility to nourish children and the whole family, but also to create more space, access, opportunity, education, and what is all needed to make women and men equal and to recognize women in their full strength and leadership. The event is organized by 5 organizations: the World Health Organization, UNICEF, the Bill and Melinda Gates Foundation, the Children Investment Fund, and the Micronutrient Forum. And before we kick off, I would like to let you know that there is simultaneous interpretation. Look at the bottom of your screen. There is English, French, and Spanish interpretation. There is, of course, also a Q&A box, and I love interaction during the event. So the sooner you can put already your questions into the Q&A box, the more we can weave it in our conversation with all these spectacular leaders. If you have technical difficulties, send a direct message to the technical support, and they will do everything to get you in as soon as possible. And of course, the event will be recorded so that people who are not able to make it, which is already a pity, of course, because almost 140 people are already involved. But if you are not able to make it, or you want to look at it and experience it again, you can go for it later. Please use your mute, and for the participants put away your cell phone for 1.5 hour, because here we go with the first speakers. I have already a kind of set the scene for this event. So without further ado, I would like to go to the first speakers that we have uplined for you. And the first will be from a leader from the national government, who is Dr. Ariela Luna Flores. And no, sorry, I'm making a mistake. I'm running too fast. The first keynote speaker is Faizal Sultan, and he is the special assistant to the Prime Minister of Pakistan. And he is a busy man, let me tell you, because Pakistan is one of the scaling up nutrition movement. And I know that in Pakistan, on the agenda of the Prime Minister, it's all about nutrition through healthy and sustainable food systems and climate. So I think Dr. Faisal is a busy man, and for that reason, he has a recorded message. Over to the message of Dr. Faizal Sultan.
Pakistan is one of the first countries in the world to adopt the Global Sustainable Development Goals nationally to achieve a 40% reduction in stunting and reduce and maintain wasting below 5%. Maternal nutrition is the foundation for maternal and child health. During pregnancy and early childhood, the foundation of proper growth and well-being of a child depends on good maternal care and nutrition. Women in Pakistan are disenfranchised by various factors, and each of these factors creates a vicious cycle which negatively impacts women's health and in turn their children and their chance at a healthier life. Socio-economic barriers limit women's access to nutritional food. In most marginalized populations, women forego their own nutrition and prioritize their family members' nutrition over theirs due to the lack of resources. This contributes to a cycle of nutritional deficiency. Experts have concluded that women who weigh less than 100 pounds are more likely to deliver prematurely or give birth to an underweight baby. Children of malnourished women are more likely to face cognitive impairments, short stature, lower resistance to infections, physical disabilities, and a higher risk of disease and death throughout their lives. These physical disabilities and impairments have economic dire consequences for the child and their family. Well-nourished women have safer pregnancies and deliver healthier babies. Adequate nutrition is a fundamental cornerstone of any individual's health. Child nutrition remains a public health problem in Pakistan, and currently the rates of wasting, acute malnutrition, and stunting, which is chronic malnutrition, in children under 5 are extremely high at 17.7% and 40.2% respectively, according to the latest government figures. In Pakistan, women of reproductive age bear the triple burden of malnutrition, which is undernutrition, overweight, obesity, and micronutrient deficiencies. This is according to the NNS 2018. In this age group, 14.4% were underweight, 24% were overweight, and 13% were obese. And this data is from 2018. There is also a very high prevalence at 41% of anemia in this age group. If we talk about adolescent girls who are going to be future mothers, we see that the vicious cycle of malnutrition starts during this time for girls between the ages of 10 and 19 years. Around 12% of girls in Pakistan are underweight, and around 30% are of short stature. Similarly, 60% of girls suffer from anemia. These figures help us understand what we must focus on and why we must focus on, which is adolescent girls and women of reproductive age, to control malnutrition amongst children. Keeping these statistics in mind and the importance of nutritional status and the well-being of adolescent girls and women of reproductive age, the government of Pakistan has given utmost priority to the status of women in the country. All policies and strategies in health, nutrition, human rights, safety, security, and the workplace are female-centric and equity-based. for women. In the health sector, the utmost importance has been given to antenatal care and deliveries by skilled healthcare providers. During the last 5 to 7 years, special support has been provided to pregnant and lactating women through social protection to facilitate their travel for utilization of healthcare and other services like delivery. This has dramatically increased the births occurring at health facilities from 48% in 2012-13 to 66% between 2017 and 2018. This is the same survey conducted at two different time frames. And births by a skilled healthcare provider have gone up from 52% to 69%. Moreover, the Asas Nashonuma program focuses on enrolling the poorest and underprivileged families. Under this program, pregnant women receive specialized nutritious food during their pregnancy and the first 6 months of lactation. Later, their children between the ages of 6 and 23 months also receive this SNF to prevent malnutrition and stunting amongst children. The Prime Minister of Pakistan has made malnutrition amongst children a priority agenda for the government. In his inaugural speech to the nation, he highlighted this important issue and its effect on the future generations' physical and cognitive growth and development, and consequently on the country's economy. The Pakistan National Nutrition Council, PNNCC, under the chairmanship of the Prime Minister of Pakistan and the National Nutrition Advisory Group under the Ministry of Health, are the highest fora for providing leadership for coordinating nutrition interventions in the country. The Council is co-chaired by the Minister for Social Protection. The Council is highlighting the importance of women-centric policies and gender equity in planning related to nutrition and social protection initiatives. At the national and provincial levels, multi-sectoral nutrition strategies and the protection and promotion of breastfeeding laws has been enacted. The Ministry of Health is working with the stakeholders to enact mandatory food fortification laws at the national and provincial levels. Under the leadership and guidance of the Prime Minister, the Ministry of Health has developed a large-scale national nutrition move focusing on malnutrition amongst adolescent girls, mothers, and children in districts with the highest burden of stunting and wasting. A large-scale national nutrition program is being developed by the Ministry of Health with special emphasis on adolescent girls to address anemia and other pregnant and lactating women initiatives targeting malnutrition. The program will provide these women with a supply of special nutritious food, SNF, and target micronutrient deficiencies through multi-micronutrient supplementation. A $2 billion project over 5 years titled Tackling Malnutrition Induced Stunting in Pakistan will target 30% of the population of the country through nutrition interventions, including 15 million women of reproductive age and 10 million children under the age of 5 years. More than 30% of the commodities and supplies of around $248 million will be used for adolescent girls and PLWs, and this national program completely aligns with the UN call to action on malnutrition and addresses all its components. Through all these initiatives and the commitment of the federal government and provincial governments, we will be able to target all forms of malnutrition amongst adolescent girls, including anemia and micronutrient deficiency. We will also increase the coverage of wasting from 10% to more than 50% in the near future, which will save a large number of lives of children under the age of 5. The major stakeholders, United Nations, CSOs, development partners, must work together with the government to address the menace of general malnutrition in Pakistan. Thank you for making me a part of this forum. And together, I believe by prioritizing maternal nutrition, we can combat
Thank you very
child
much, Dr.
malnutrition
Faizal
globally.
Sultan, advisor to the Prime Minister of Pakistan. Maternal nutrition is crucial, and nutrition is the fundamental foundation of everyone's health and life. You have been able to explain the huge challenges Pakistan is suffering from, but you also have made clear how committed the government is with His Excellency the Prime Minister as in personal leadership, how you want to make progress on all three forms, the triple burden of malnutrition, undernutrition, overnutrition, obesity, and overweight, but also the micronutrient deficiencies. Anemia is a huge, huge burden. Thank you so much. Let us now go to Dr. Parul Christian from the Johns Hopkins University. And I'm extremely happy to announce that you have already received a question, because you are an expert also in developing programming for women's nutrition. And very often you must have seen that those women who have the least access to good nutrition are also very often the most poor women. So how to combine addressing the agenda of poverty and malnutrition in preventing or fighting women's and of course children's malnutrition. Over to you, Dr. Parul Christian.
Thank you, Gerda, and greetings from Baltimore. Many thanks to the organizers for inviting me to speak at this exciting event and on a topic that is close to my heart. Women are girls are drivers of development and influencers of health and well-being of themselves, but also their own families. To equip them to succeed in school, to maximize their work productivity, and to have their own healthy children, if they so choose, they must receive the appropriate nutrition they need right from the start. And I'm here to make the case that evidence-based, cost-effective, affordable solutions to improve women's and maternal nutrition exist and can be scaled. Next slide, please. So let's review the global progress in women's nutrition. The recent Lancet Nutrition series examined this over the past 15 years. What did we learn? The graph on the left shows 3 indicators of maternal undernutrition: maternal low BMI, short height, and anemia, and their prevalence rates in 2000 and 2015. Low BMI among women has halved during this period and matches the worldwide trend of increase in average BMIs. However, reductions in short stature and anemia are small. There are over 500 million women who are anemic and another 30 million who are anemic during pregnancy. Shown in the right is a map of subnational data on BMI less than 18.5 using smaller geographic units within countries. There are numerous subnational hotspots marked in the salmon and red and orange colors for low BMI in South Asia and Sub-Saharan Africa, showing that while national rates may have improved, there exists disparities within countries. Next, please. Maternal undernutrition, as was mentioned by Dr. Sultan, is one of the major drivers of poor maternal health and adverse birth outcomes. Annually, 22.5 million newborns weigh less than 2,500 grams at birth. And low birth weight is a risk factor for increased infant morbidity and mortality in the short term, but also poor postnatal growth and poor cognition. The World Health Assembly target is to reduce low birth weight by 30%, but many countries are lagging behind and will fail to achieve this target. The 2 underlying drivers of low birth weight are being born too small, or small for gestational age, or being born too soon, that is preterm. On the left, I have highlighted the maternal nutritional status indicators of short stature, low pre-pregnancy BMI, low weight gain in pregnancy, and micronutrient deficiency anemia, which are major determinants of the adverse outcomes of low birth weight, small for gestational age, and preterm birth, and need to be addressed. The good news is that there are a number of evidence-based, cost-effective, affordable interventions available to enhance maternal nutritional well-being in the context of pregnancy. The recent WHO antenatal care recommendations for a positive pregnancy experience include numerous guidelines for addressing maternal nutrition. Dietary counseling and iron and folic acid are recommended, whereas multiple micronutrients, balanced energy and protein and calcium supplements are context-specific recommendations. Balanced energy and protein, also known as food supplementation, is recommended in the context of high burden of maternal undernutrition and low birth weight. Multiple micronutrient supplements containing iron and folic acid versus iron and folic acid alone in 19 randomized controlled trials has been shown to be a superior intervention for reducing low birth weight and other adverse birth outcomes. Daily high-dose calcium is recommended to reduce hypertension and preeclampsia in pregnancy when calcium intakes are low. Next, please. I want to provide an example. Can you go to the next slide, please? Yes, thank you. I want to provide an example of how the intractable problem of anemia in women and girls could be tackled using a tiered life course prevention and treatment approach. The bottom of the pyramid shows that for women and girls, a robust food fortification effort is needed and has been proven to be effective for reducing anemia. Where the prevalence of anemia is high, fortification can be augmented with intermittent weekly iron supplementation as recommended by the WHO. For pregnant women, daily supplementation with iron and folic acid, or better still, multiple micronutrients, needs boosting through antenatal care alongside context-specific deworming and IPTP. Antenatal hemoglobin screening can be used to treat the more severe forms of anemia with the use of short infusion intravenous iron as practiced in high-income countries. If each tier is effective, then the next tier will be smaller as prevention is the goal. Next, please. Thus, we are at the right moment in time to double down efforts and funding for women's nutrition, and I urge the global community to grab this opportunity. Interventions in pregnancy are some of the most cost-effective interventions that need to be scaled. Addressing anemia in women is urgent and important, and we should not delay any efforts on this. Clear, rigorous, and consistent evidence shows that antenatal multiple micronutrient supplements containing iron and folic acid is a superior intervention than iron and folic acid alone, and countries should begin efforts to switch to this, such as in the example of Pakistan we just heard. Calcium supplementation in low intake settings can reduce risk of preeclampsia, and targeted balanced energy supplementation in high burden areas of maternal undernutrition is needed to support the mother and the infant. Targeted BEP can be done in subnational geographic hotspots that I showed. Finally, nutrition guidance for pregnancy exists, but implementation lags, and the nutrition quality in antenatal care needs urgent attention. Thank you very much.
Thank you very much. But Dr. Parul, please stay on, because I would like to ask you two questions. One is the question you have, I was listening like all of us, I think, like we were your students, but I'd like to learn a little bit more about the how. So you're also an advisor in strategy and programming, and everybody is convinced of the need to do something. But what would you advise to a minister, to a government in a very poor country? What need to prioritize to get this done in a most cost-effective way, reaching as many as possible poor women?
So I think that I was trying to make the case for strengthening antenatal care and bringing nutrition within antenatal care alongside all the health services that women ought to receive during pregnancy. Nutrition has been very neglected in antenatal care over the years, and unless we bring all of this together for the woman and have them have this pregnancy experience and a start for the newborn, the fetus and the newborn, in the way that we want to, we will not be able to stop that intergenerational cycle of growth failure and poor development that exists. So if I were to prioritize, I would prioritize the antenatal care, care that is nutritional for women in these contexts.
Great. Thank you very much for your contribution. Much appreciated. Then
Thank
we
you.
go to, because you're also the only one who is speaking live here, so we can have some interaction, which is of crucial importance. Then we have a recorded messages from Gargi Ghosh, the president of the Global Policy and Advocacy from the Bill and Melinda Gates Foundation. She is overseeing government affairs, economic policy, advocacy, and philanthropic partnership. That's a lot, but I think she will speak to us on a strategy on women's nutrition right now. Over to Mrs. Gargi Ghosh.
Hello, everyone. First, I want to extend my sincere thanks to WHO, UNICEF, SIF, and the Micronutrient Forum for their partnership on today's event, and for ensuring that women's nutrition is elevated as a key priority at the Nutrition for Growth Summit next week. My name is Gargi Ghosh. I'm president of the Global Policy and Advocacy Division at the Bill and Melinda Gates Foundation. And I'm here today because women's nutrition is, put simply, one of the most impactful areas of global health. And yet, as a global community, we have consistently underinvested in it, and that needs to change. The impact of women's nutrition is enormous, both in terms of its toll on women's lives and its potential to radically accelerate progress across the global goals if we get it right. Too often, nutrition gets overlooked. The issue is complex, the answers aren't easy, but we can't lose sight of how urgent this agenda is and how essential it is to the success of our work across sectors and goals. Poor maternal nutrition is a major driver of maternal and infant mortality. It's an underlying cause of 1 in 5 maternal deaths and accounts for 7% of the global disease burden. Higher risk pregnancies, babies born too soon or too small, increased risk of death and disability in infants and young children. The cost is too high, and the pace of our action is too slow. The world was making progress on reducing maternal and newborn deaths, but reductions have slowed since the MDG era, even prior to the pandemic. Despite its enormous intergenerational impacts, we know that women still suffer disproportionately from malnutrition. It's not by chance, it's driven by inequity and disempowerment. A World Bank study found that women's nutritional status is driven more by inequity within households than it is by poverty. 75% of underweight women live in households where the man is not underweight. And when the inequities we see at the household levels are magnified across health systems, nations, even our global frameworks, the consequences are devastating. Take anemia as one example. Like many health issues, anemia disproportionately affects women. It's too common. It's under-researched, it's underfunded, and its impacts can be devastating. While largely invisible, anemia robs the health of more than 1.5 billion girls and women each year. For women, it puts their survival of childbirth at risk. And for their babies, it can have lasting impacts on growth and brain development. We know that if we scale up interventions to get women better diets, fortify foods with essential vitamins and minerals, deliver nutrition supplements to pregnant women, and diagnose and treat anemia when we see it, we could save nearly 800,000 children's lives and put more than $110 billion back into the economy. Of the 6 World Health Assembly nutrition targets, it's the only one that is specific to women, and it's the one for which we are seeing the least progress. The global prevalence of anemia among women of reproductive age actually worsened by 15% between 2000 and 2019, again, before the pandemic. And when we look at the other targets that closely align to women's nutrition, low birth weight, breastfeeding, wasting, we just are not moving quickly enough. The lack of progress against these targets represents a fragmented and under-prioritized agenda for women's nutrition. That's why it's a priority we are investing in across every single one of the Foundation's global divisions. Our work addresses the ways that healthcare, diets, social safety nets, gender equality, and better policy and financing can all do their part to transform the women's nutrition agenda. It's not the responsibility of any one system or one intervention to get the job done. It's a collective responsibility, and we need to start taking collective action now. As many of you know, Melinda Gates delivered our $922 million nutrition commitment, our largest ever, at the UN Food Systems Summit recently. Within this commitment, we're looking at a number of ways that we can play the most effective role in supporting women's nutrition globally. First, We are redoubling our efforts to understand what it takes to deliver women's nutrition through health sector platforms, community-based platforms, and social protection systems. We're focusing on how to strengthen systems to deliver proven, cost-effective interventions that we know work, but simply haven't achieved the scale they warrant. Multiple micronutrient supplements are a great example. Designed specifically for pregnant women, MMS is a cost-effective and proven intervention that can transform maternal health and birth outcomes for mothers and babies everywhere. Second, we're investing in new game-changing solutions that aren't being implemented widely, but that have great potential to accelerate our progress. Balanced energy protein, for example, is a nutrition supplement designed specifically for malnourished pregnant and lactating women. It holds incredible promise for improving women's health and supporting healthy pregnancies, and for ensuring that babies are born healthy, on time, and at the right weight. Third, improving women's diet is fundamental to any effort in women's nutrition. We know that unless agricultural programs are designed to deliver improved nutrition from the start, they probably won't. We're supporting local efforts to ensure that agricultural programs focusing on smallholder farmers, smallholder producers, are both empowering women and delivering safe, affordable, and nutritious diets year-round to low-income people, especially women. Fourth, we know we must prioritize gender-responsive nutrition programming. Women and girls have unique nutritional needs that vary depending on where they are in their life cycle, and gender norms are often the key barrier to women accessing better diets and healthcare. Women and girls bear the greatest burden of malnutrition and therefore have the greatest potential to benefit, making coordinated action an imperative for equity and justice. We are particularly pleased to be supporting the development of a global action plan on anemia, led by the World Health Organization, which you'll hear more about today. The world needs a blueprint to accelerate progress on anemia in women of reproductive age and children. Finally, we are committed to raising our voice to elevate the importance of women's nutrition as a central component of our cross-cutting health advocacy agenda in the coming years. We need a women's nutrition agenda that is evidence-based, financed, and accountable. We must invest in women, and together, we will. We're so appreciative of the leadership of our partners here today, and we look forward to continuing to deliver on this agenda with you. Thank you.
Thank you very much, Madam Ghosh, for a clear agenda. I would like, because I would have loved to call Dr. Christian back to the screen, but time doesn't allow us. Dr. Christian, please have a look at the Q&A box. There are a few questions specifically asked to you. Please answer them, and maybe later we can also do a little bit the back and forth. So right now, here we are. We have the frame working right now, a lot of problems and a lot of ways forward, but I want to focus a little bit more on the how. The best start in life is, of course, during the first 1,000 days of a child, because that is where it all happens. The second opportunity is adolescent girls, and then prenatal or antenatal and support during pregnancy of women. It's not always a matter of poverty, it is also a matter of equality. Let us not forget this, inequality between men and women within families. So investing in women's nutrition and girls' nutrition is not the right thing to do, it's the smart thing to do. And to do this, it is crucial to have a multi-sectoral approach at a country level, but with involvement and commitment of the government. And this is a brilliant bridge to our next session here, because we have 3 speakers from the country level. We have Her Excellency Ariela Luna Flores, the former Minister of Development and Social Inclusion of Peru. And I'm quite sure she is eager to speak on the how to drive this agenda and how to make progress, including all players that need to be included. Then we have a recorded message from the Honorable Minister of Health, Professor Charlemagne Draogo, from the Minister of Health from Burkina Faso. And then we have Mrs. Kazi Zebu Neza Begum, but I'm allowed to say Kazi, and she is the additional secretary and Sun country focal point of Bangladesh. Let us focus now on the how to get it done, because this needs to be an action side event focusing on how to make the needle move into the right direction. Over to you, Your Excellency, Madam Former Minister. Buenos días.
Buenos días con todos y con todas. Gracias por la presentación. Yo voy a contar rápidamente la historia de Perú. Perú es uno de los países que más rápidamente ha bajado la desnutrición crónica infantil en el mundo. En 8 años hemos bajado 12 puntos porcentuales. ¿Cómo lo hicimos? Y quiero tomar el ejemplo de la anemia en las mujeres. Estoy totalmente de acuerdo con los expositores anteriores para esto. Lo primero que hay que hacer es mirar, ya, quiero reducir la anemia en las mujeres. Muy bien. ¿Es un tema de salud solamente? No, no es un tema de salud. Para implementar hay que pensar en todos los factores. Si yo tengo anemia, tengo deficiencia de hierro, pero también probablemente no acceda bien a la alimentación por factores culturales, de género o por dinero, por acceso a los alimentos. Entonces, la mejor estrategia es la atención prenatal, totalmente de acuerdo. La evidencia científica nos dice que es la atención prenatal. Para que yo llegue a la atención prenatal, tengo que vivir cerca del establecimiento. Si estoy a 10 horas, no voy a llegar. Si vivo cerca, voy a llegar al establecimiento. Una vez que llego al establecimiento, tengo que recibir las pastillas, el suplemento de hierro, pero también la consejería sobre cómo tomarlas, etc. Muy bien, llego a mi casa, las tomo, me producen náuseas, me producen gastritis, las dejo de tomar. Entonces, la consejería no fue buena, no me permitió entender totalmente, empoderarme sobre mi anemia y vencerla. Pero en la casa también tengo que acceder a alimentación. Pero en la casa la comida la tienen, la mejor comida la tienen los hombres, la mejor comida la tiene la suegra, etcétera, y no llego, no accedo a la comida necesaria o no tengo dinero para comprar. Como vemos, la implementación es una gama de factores. Primero, no es un tema solo del Ministerio de Salud, es un tema de todos los ministerios, es un tema de desarrollo, es un tema de derechos. Lo que tenemos que hacer es concientizar, evangelizar, digo yo, entre comillas, a todos los funcionarios para que entiendan que la inversión en las mujeres, en las niñas, en la infancia, es indispensable para el desarrollo del país. Y eso también tienen que entenderlo los empresarios, porque sin un buen capital humano no vamos a lograr un desarrollo. Entonces, un tema importante es sacar el tema de la nutrición solamente de intervenciones de salud, pero también mirar las intervenciones de salud como un complejo de factores que hacen que la gente acceda o no acceda. Esta es una lección aprendida que tuvimos, y la última que tuvimos fue que hay que medir. Hay que medir cómo estamos, medir, y los estados no debemos tener problemas en comunicar a la población cómo estamos y hacer pactos con ellas para lograr. Y en toda esta tarea las mujeres son un elemento protagónico que sin ellas sería imposible lograr lo que se tiene que lograr para toda la humanidad, que es una infancia y mujeres y niñas saludables. Y yo me quedaría ahí. Muchas gracias y espero que haber compartido en algo la experiencia de Perú.
This is excellent, Madam Former Minister. It is a matter of development and human rights. We need to indoctrinate, we need to teach, and if that's not enough, we need to indoctrinate how important nutrition is to all decision makers, and maybe include it, of course, in education. And remove nutrition from its silo. It is music to my ears, and it's music to the ears of all listeners. And you are speaking so much to the point that I think everybody gets it and knows that the action agenda needs to be driven and owned by the government. It can be driven also by others, but it is crucial to work together and to understand where people are in their culture, in their family, in their community, but make sure that women get what they need in order to maintain the human species. In the end, and that's also one of your conclusions, without women, no future for human mankind. Thank you so much. And if possible, please answer one or two questions in the Q&A box. Then we go to a recorded message from the Minister of Health of Burkina Faso.
Chers partenaires, le Burkina Faso, dans sa dynamique de lutte contre la malnutrition, s'est résolument tourné vers l'amélioration de la nutrition maternelle. D'énormes progrès ont certes été enregistrés ces dernières années, mais le chemin est encore long pour atteindre les cibles des objectifs de développement durable. Ainsi, la fortification et la disponibilité des micronutriments occupent une place de choix dans cette démarche. Pour maintenir la dynamique, mon pays s'engage à promouvoir davantage l'allaitement exclusif en passant d'un taux de 55,8% en 2018 à 69% d'ici 2024, à augmenter le score de diversité alimentaire chez les femmes en âge de procréer de 15,2% en 2018 à 26% en 2024, à augmenter la contribution de l'État au profit de la nutrition à 3% avec un focus sur la nutrition maternelle et infantile, à valoriser les données nutritionnelles pour une meilleure capitalisation du retour sur investissement dans la nutrition maternelle. L'innovation majeure des engagements de Burkina Faso en lien avec la nutrition maternelle est la prise en compte de la diversité alimentaire par la promotion des mets locaux et une amplification de la fortification. L'approche multisectorielle sera privilégiée avec une contribution forte des secteurs sensibles à la nutrition, dont l'agriculture et le commerce. Je vous remercie.
Thank you very much for the clear messages, to the point, spot on, and an action-oriented agenda. That is what we like. Thank you very much, Your Excellency. We would like to hear much more, of course, from Burkina Faso. But we might have time also for some Q&As after this. We have heard from the three national governments, because first we want to hear from Bangladesh, and we would like to go to Ms. Kazi Zebunessa Begum, the focal point and attorney, additional secretary and in the Minister of Health. Over to you, Dr. Kazi.
Thank you, Garda. Maybe my video is not on.
Well, it's just start talking and the technical team will take care of everything, but we are listening.
Okay.
There you go.
Thank you very much. Good afternoon. It's a great privilege for me to speak here today. This is really wonderful initiatives to bring powering women, promising futures, and good initiatives to bring powering women, promising futures, and good nutrition in the table of discussion. Women are power of the society. Women, maternal and girls, nutrition is not simply a matter of poverty. It is also born from inequity and inequality. So we must address it to pave the way to make an end of inequalities, inequities, and discrimination against women. Bangladesh is addressing the intergenerational cycle of malnutrition through its multiple policies, investment in programs, building strong coalition among multi-sector and multi-stakeholders to influence the major drivers of gender and nutrition in last decade, especially to empowering women. Even though the nutrition status of the country's women are still not in that up to the mark. We have underweight among women and children of women of childbearing age about 19%, short stature 13%, overweight 24%. Anemia in pregnant mother is about 50%. It's really alarming. and also 70% young adolescent girls of age 10 to 14 years are underweight. So this scenario says that we must focus on adolescent girls and women health and nutrition. I am very excited to attend Nutrition for Growth Summit to be held in Japan in the next month. We have given utmost priorities to keep the gender issues and women empowerment during finalizing our commitments for N4G. We have finalized 12 commitments, and one is directly involved with the women nutrition to reduce the anemia among women of reproductive age. Other 6 commitments also indirectly will empower the women, improving their nutrition. Rest 5 commitments will endeavor the process of improving and monitoring the progress of women empowerment. Meanwhile, we have revised our major policies and articulated pathways of development with women, and especially focused on women's participation, recognized their role in the development, and promotes institutional leadership role to contribute overall development of Bangladesh. Bangladesh is closely nurturing Sun movement with focus to everyone's participation, promoting leadership in both formal and informal sectors, which collectively contributes towards multi-sectoral programs to improve the women, adolescent girls, and maternal nutrition. I hope together we will come up with more focus on this issue with more investment to make the women more empowered. With this, I would like to conclude. I thank you all once again. Thank you very much.
Thank you very much, Kazi, for the clear message. A lot of things to be tackled, but the government of Bangladesh is firmly determined to make this happen, and will have a strong commitment at the N4G summit in the hope there will be support, financial support, but also let's say about capability development from other actors and global players in the world. Dr. Luna, there is a special question for you in the Q&A box. I would like to invite you to answer this question and maybe give also 3 concrete commitments on where to start, because this should be about the action, and you have proven that you are taking action. So please share the 2 or 3 steps that you would recommend to start with. To finalize this session, it is recognized by the national leaders that women are the key to a better future. Less poverty, but also less inequality and inequity. But to do this, the recognition needs to be there by each and every decision making, but also by men and the cultural leaders. Equality between men and women, taking good care of female nutrition is crucial if you want to make this world a better place, and if you want to continue to invest in human mankind, because the women are the bearers of life. With this, I move on to the next topic in this event on empowering women, promising futures. And we will hear from some global leaders. First of all, we start with Henrietta Fore, still the executive director of UNICEF, and it's a miracle that she has committed to deliver a speech in this event. It is emphasizing her commitment to girls and women, and it's emphasizing even more, underscoring her belief that nutrition is the game changer and the way forward to more equality and equity and a prosperous future for all. Then we will hear from Dr. Naoko Yamamoto, and she is an Assistant Director General in the World Health Assembly and World Health Organization, dealing with universal health coverage, and she is also a great nutrition champion. But first we hand over to Henrietta Fore, who, by the way, is also still the chair of our Sun Movement Lead Group. Henrietta, over to you.
Thank you very much, Gerda, and I wouldn't miss a great nutrition event like this. Good morning, good afternoon, good evening, everyone. Malnutrition in all its forms affects millions of women around the world, and 1 in 10 women are undernourished, while 1 in 3 are anemic, and as many are overweight. Combined, these 3 conditions rob millions of women and their children of the futures that they deserve. To power women forward, we need to invest in their nutrition. This supports not just women's well-being and their ability to participate fully in society, but also the nutrition, growth, and development of their children. At UNICEF, we are committed to breaking the cycle of malnutrition, working together with governments and other partners. Today, we commit to 5 actions. First, we commit to improve the quality of women's diets. This means supporting policies and programs that deliver essential nutrition services to women. It also means improving the quality of nutrition and care practices at key moments in women's lives, from adolescence through pregnancy and breastfeeding. Second, we commit to actions across systems. With the food system, we will promote nutritious, safe, and affordable diets and support large-scale food fortification. With health systems, we will work to integrate essential interventions such as nutrition counseling and supplementation. And with social protection systems, we will advocate for policies and programs that focus specifically on women. These include maternity benefits for all pregnant and breastfeeding women, as well as cash and vouchers for the most vulnerable. And third, we commit to innovation. We will explore innovative ways to meet women's nutritional needs through multiple micronutrient supplements. We will seek to increase coverage across the public sector while testing delivery approaches through the private sector. And we will work to bridge the digital divide so that more women can get accurate and timely information on nutritious diets. And fourth, we commit to investment in data. In 2022, we will launch a flagship report on the state of women's malnutrition, which will spotlight the need for increased accountability. And fifth, we will commit to listen. To design programs that better support women's needs, we need to listen to women's voices. And that is why I'm delighted that Fadila Gubari from Yemen is with us here today to share her thoughts on how girls' nutrition, health, and equity is critical to communities and nations in meeting their future potential. This is an ambitious agenda, and we cannot achieve it alone. Breaking the cycle of malnutrition requires commitment and action from us all. So I would like to acknowledge some key allies who share our commitment: the governments of Bangladesh, Burkina Faso, Canada, Pakistan, and Peru, and our partners at USAID, Bill and Melinda Gates Foundation, the Children's Investment Fund Foundation, and Nutrition International. Last but not least, let me also mention our sister agency, the World Health Organization, with whom we are joining forces to address the burden of anemia in women. And we will soon hear from Dr. Yamamoto. So thank you very much, Gerda, and we are hard at work also in the Sun movement.
Sure. Thank you so much, Henrietta, for your strong leadership on this and the strong leadership and commitment of UNICEF, working with so many partners, also with and within the Sun movement, because many of the partners are also a member of the Sun movement, and we are grateful and thankful for your leadership. We don't like to see you go. That is the bridge to also Naoko Yamamoto. Naoko, you have the floor.
Thank you, Herda. It's great to join with the leaders, ministers, but especially, and also NGO, civil society group, and especially with Henrietta Fore. I'm really happy to see you. So, first of all, I would like to say that For WHO, obviously, nutrition and health for all is a core agenda. There's no question. But first, I would like to reiterate the magnitude of global burden of anemia. 30% women of the reproductive age, 37% of the pregnant women, and 40% of the children 6 to 59 months of age are suffering anemia. It's huge magnitude. But because women and the caregiver and provider of the household and children is a core of the future of the development, we need to recognize that anemia is an issue of women, but also the issue of the whole member of the community. Second, I would like to say that here we see the trend. Most countries are off track for the 50% reduction by 2025 target. Very small number of countries is going to reach this target. So this expresses that we need to approach root of causes for anemia, including poor living condition, working condition, gender inequity, harmful cultural practice, inadequate healthcare approaches, and lack of access to food of good quality. So at WHO, first, WHO commit to deliver global action plan to prevent and manage anemia in women and children. This plan to provide effort to reducing both prevalence and severity of this condition. And this plan would advance the global nutrition target. And the second commitment is with WHO and UNICEF and the global group of country and partners organizations. We commit to establish an alliance for the anemia actions. And this alliance will coming soon, and we advocate accelerated action. And this alliance will have a clear, broad selection of the actors from the multiple sector and a clear governing structure. And another issue is within WHO, anemia is linked with maternal child health, UHC, PHC, sexual and reproductive health, neglected chronic diseases, malaria, and of course, nutrition for food safety. So internally at WHO, also with the headquarter regional office countries together, we need to work, we will work at a more integrated initiative for anemia as WHO together with all partners. Finally, WHO is a member of the UN Nutrition and also is a core member of the partner of the some movement. So we committed to work together with all of you. Let me stop. Thank you, Herda.
Thank you very much, Dr. Naoko Yamamoto, for this great commitment. We can see the action agenda is building up, but it is also so crucial. There are too many people who want to speak up and now who are brought to the micro and to the camera in this event, but all your commitments are recorded and we are going to hold you to account, and that is what you ask for. It's crucial, it's needed, it's investment in women, and women is half of the world, and it's a pity that we need this action, but let us get it right for the future. Thank you very much, Henrietta. Thank you very much, Naoko. And let us move to the next block of our event, because indeed, we want to hear the youth advocate from Yemen speak to us in the closing session. But first, we go to the bilateral donors, government leaders, and I am happy to introduce and welcome Joshua Taba. He's the Global Health and Nutrition lead of the Global Nutrition Bureau of the Global Affairs of Canada. He has many other activities, but I know he's very much committed to the nutrition agenda and also very committed to the women's agenda. Then we go to Omar Dari, and he is from USAID, and he is a nutrition science specialist. And he has a lot of experience, and I would like to hear from him about the USAID commitments, very concrete commitments, and the action agenda. Over to you, Joshua.
Thank you, Gerda. It's an honor to be with you alongside nutrition leaders from around the world. The core essential idea we are discussing today is foundational to Canada's international assistance. Empowerment and equality bring lasting change to communities in many areas, and for nutrition in particular. When girls and adolescents are healthy and nourished, they stay in school, learn, thrive, and have opportunities to reach their full potential. When women are empowered and given control as agents of change, they're more likely to access health services and ensure nutritious meals for themselves and their families. Our global nutrition and our global gender equality objectives have the same drivers: respect, inclusion, dignity, and equity. Canada's international assistance has gender equality at its core. Our efforts, our development work seeks every opportunity to empower women and integrate gender considerations. To achieve this collectively, we must increase our focus on unmasking and understanding barriers to equity. Feminist analysis can help reveal the power dynamics of marginalization and the intersecting vulnerabilities that drive malnutrition and that must inform our efforts. Understanding why and where women are eating last or eating least and what can be done to address it requires gender and feminist analysis. For decades, Canada has supported partners to tackle malnutrition at all stages of the life cycle, with a focus on maternal and child nutrition and micronutrient supplementation. We take a twin-track approach that includes high-impact immediate interventions alongside longer-term interventions that tackle the root causes of malnutrition, including inequality and marginalization. We have doubled down on this focus during the pandemic. When COVID struck, Canada and others saw the importance of including gender-sensitive nutrition programming within our response and advocacy efforts. Of the more than $2 billion we've allocated for our international COVID response, over $62 million has been directed to agriculture, food security, and nutrition response programming, all with gender considerations at their core. And we've also allocated over $173 million to the World Food Programme for emergency food aid and humanitarian action. There is an increasing need for better nutrition-related data, and this must include gender and age disaggregation. For example, we need a much deeper understanding of the impact of COVID-19 on women and on adolescent nutrition, and Canada is partnering with Standing Together for Nutrition to explore this further. As you all know, empowerment is only possible within a holistic and comprehensive approach. We will continue to back holistic interventions and to focus on nexus areas of nutrition that overlap with health, humanitarian assistance, climate smart solutions, sexual and reproductive health and rights, and food systems. And we are putting considerable financing in place to support this. Last December, we were pleased to work with Bangladesh and many of the key partners here today to co-launch the Nutrition for Growth Year of Action. The $520 million we pledged for nutrition-specific interventions over the next 5 years will have gender equality at its center. We want every dollar to reduce malnutrition and to increase equity, making a difference for the most vulnerable. During the N4G Summit next week, Canada will outline more details of our nutrition priorities for the coming years, including a continued focus on women's nutrition through empowerment. We will continue to work with existing platforms, such as SUN, to leverage collective voices to raise equity and women's empowerment on the global nutrition agenda. We will also follow emerging opportunities and new platforms, like the Anemia Alliance just announced by the WHO, that have great potential to accelerate progress on women's nutrition. Canada will continue to ensure that its support to both high-impact nutrition work and longer-term system strengthening is invested with equity as a common denominator, supporting women and girls as agents of change. Working with all of you, we can reclaim the gains that have been lost and create a positive cycle through feminist international assistance, combating malnutrition through equity and participation, and increasing inclusion through nutrition, with a focus on empowering the girls, adolescents, and women who need this most. Thank you.
Thank you very much, Joshua. And I am looking at the Q&A, where there is a statement made that we need to postpone the WHO targets on anemia to 2030 because we will not be able to reach them. I would say instead, and listening to all of you, I would say we need to double down and work together to get it done, because giving up, giving in is not an option. We leave too many women and girls behind. Without further ado, and thank you once more, Joshua, for the great commitment of the government of Canada, we go to Omar Dari to hear about the ambitions and the strategy of USAID. Over to you, Omar.
Thank you, Gerda, for the introduction. It is a pleasure to join all today to speak about the importance of investing in nutrition aimed to benefit women and girls. It has been said that the physical, mental, and social development of the current generation has been determined in part by the quality of their grandmother's health and nutrition in her early life. This demonstrates that the continued link from generation to generation through the maternal line. Women's high nutritional requirements start during adolescence and remain high during all their reproductive years and are even higher during the pregnancy and breastfeeding periods. Therefore, attention to the nutritional needs and health status of girls and women deserves specific attention. However, it is important to realize that women do not live in a vacuum. They are part of families and communities. Thus, in the current global attention to systems, we need to strengthen the family system so that the special requirements of nutrition and health of women are recognized. Women's roles are appreciated and they receive the support and help that they deserve. USAID has long-standing history of supporting nutrition of the most vulnerable, and our investments seek to protect every member of the family through the life course by creating the local and national conditions to overcome poverty, prevent disease, promote health and healthy and good quality diets, and create equitable educational programs that favor girls and women. This is to ensure that everyone is well nourished and able to live healthy and productive lives. USAID supports women nutrition by improving the measurement of diet adequacy and programs focuses on women of reproductive age to enable countries to better monitor and evaluate progress toward countries' nutritional goals. Counseling women and their families to promote diverse and balanced diets and eating sufficient foods, but in moderation when they are in abundance, which include fruits and vegetables, whole cereals and legumes, and not excessive amounts of dairy products, eggs, poultry, fish, and meat, before, during, and after pregnancy to support the health of the mother and baby. Advancing food systems also is one of our attentions, transforming and to promoting large-scale food fortification when the conditions are appropriate for this intervention, to complement the nutritional value of the common diets that for whatever reason may be low in specific vitamins and minerals, and so preventing micronutrient deficiencies in all stages of the life courses. We also provide special nutritional products to mothers and their young children in emergency situations and in other conditions that those are required. Finally, I can mention promoting, favoring, and enabling breastfeeding in all environments, including mothers working in factories, markets, and in similar institutions. Improving women's and girls' diets is critical to achieve optimal nutrition for all. And moving forward, this is going to require continued collaboration and active participation of each member of the family, the communities, and the whole society. USAID is a partner with the countries to look for local ownership and leadership. Thank you, Gerda, and thank you to all for your attention.
Thank you very much, Omar. And both of you and all of you who have been speaking so far, I would love to have an interactive conversation with you on the how and what are the lessons learned and how can we share and multiply and scale up. However, time is not allowing this because we have lined up now 3 leaders of civil society who also want to make their commitment on powering women and promising futures. But I am quite sure that we will come back on this to listen once again and to continue the conversation, because only by learning, sharing and learning from each other and cross-inspiration, we will be able to make ending malnutrition for women and for all happen. We move on to the next three speakers, and we start with Dr. Nadra Franklin. She is the managing director at the FHI Solutions. You have a lot of international experience, but you have 2 minutes to frame your agenda of action and concrete commitments from the NGOs. Over to you, Madam Franklin.
Thank you so much, Gerda, and thank you to all who have joined us today. What an exciting and exhilarating event this is. I'm delighted to make our very first public announcement of a commitment to women's nutrition through an integrated policy and advocacy agenda global program in partnership with the Bill and Melinda Gates Foundation and implemented by FHI Solutions over the next 2 years. With the global focus and the commitments to women's nutrition discussed today, FHI Solutions signs on to elevate the prominence of women's nutrition interventions within the health, nutrition, and other intersecting communities. Specifically, we commit to building strong bridges with key stakeholders within the MNCH and broader health, PHC, and gender communities in order to realize our ambitious nutrition targets that include a focus on targeting of new and existing domestic and donor finances towards the women's nutrition agenda, and especially the anemia, breastfeeding, and low birth weight WHA global nutrition targets. Our commitment will contribute to 1, establishing a women's nutrition agenda as a global priority through evidence synthesis, stakeholder alignment, strategic communications, and champion deployment, and 2, contributing to overall increases in nutrition financing by increasing awareness and uptake of data to drive donor action and alignment on priority WHA nutrition targets. We will focus our advocacy on these key evidence-based interventions for women's nutrition and the delivery of these interventions through platforms across numerous sectors, including health, but also food, social, and education. We'll focus our interventions, as I said, from a gender empowerment perspective, completing an evidence translation, providing technical assistance to build stronger advocates at the local, regional, and global levels, and working through strategic partnerships at these same levels. We're excited to begin this work and add our voice to this global commitment to women's nutrition. Thank you.
Dr. Franklin, this is spot on. I like the concrete commitments and they're all very much needed. One question, please ensure that by the end, the solutions are implemented, they can be owned by women, their families, and communities themselves.
Absolutely. Thank you for reminding us all about that, but that is our commitment. Thank you.
Thank you very much. Thank you so much. We count on you. We also count on Dr. Mandama Arabi, and she's the Vice President of Global Technical Service and Chief Technical Advisor at Nutrition International. Please share your concrete commitments and actions with us. Over to
Thank you, Madam Chair, and thanks to all the colleagues and partners. It's been great to hear the commitments. At Nutrition International, we are also committed to continuing the work with partners like Pakistan and Bangladesh to scale up multi-sectoral nutrition actions and anemia at country level, to address nutrition problems together with the systemic issues and barriers that stop women's and girls' empowerment, because anemia and the problem of anemia will only be solved not just at the biological level, but also at cultural, social, and economic level. Also, because we are speaking in the section on behalf of the civil society, I wanted to acknowledge the importance of continued investments that enable us to continue acting and ensuring that women and girls stay at the center of the response to the epidemic and building their resilience in the future to the future shocks. In our case, especially the partnership of the Government of Canada and their continued support leading to nutrition and gender equality, even in the midst of the COVID. With that background, on behalf of Nutrition International, I'm pleased to announce that by 2030, Nutrition International commits to preventing at least 60 million cases of anemia, driving global focus and action on a neglected issue that heavily impacts women, adolescent girls, and children. We will do so by acting as an expert ally to governments and supporting country-led action and financing that addresses gender barriers to high quality services. We will also be developing new solutions and building political will at the global level through research, convening, and advocacy. Thank you.
Thank you so much, because this is an extremely strong commitment, spot on, focused on countries, be a technical partner, work in countries, and also a much appreciated partner within the Sun movement. We can always count on Nutrition International. Thank you so much. Then we go, last but certainly not least in this group of NGOs making concrete commitments, Dr. Klaus Kramer, and he's the Manager Director of the Sight and Life Foundation, a non-profit organization, but very much focused on nutrition-specific and concrete solutions. Klaus, over to you.
Thank you so much, Gerda, for the kind introduction, and good morning and good afternoon and evening. Today, I'm speaking on behalf of the steering committee of Healthy Mothers, Healthy Babies, a consortium that brings together organizations and individuals with a shared agenda to accelerate action on nutrition and health of pregnant mothers and their newborns to increase supply, demand, and delivery of multiple micronutrient supplementation, or MMS. MMS is an evidence-based, cost-effective, safe, and affordable intervention, as you have heard from Dr. Christian, that improves maternal nutrition and considerably reduces risk of adverse pregnancy outcomes, such as low birth weights, stillbirth, and babies born too small. Originally announced as a Goalkeepers Accelerator during the Gates Foundation 2019 Goalkeepers event, Healthy Mothers, Healthy Babies was later launched as a consortium in March of this year. The consortium has built off the impressive commitments made during the 2019 Goalkeepers event, where 11 partners committed to invest $50 million for multiple micronutrient supplementation to reach 17.5 million pregnant women by the end of 2022. Today, the consortium, with the vision and support of donors such as Kirk Humanitarian, has grown to a network of 80 nutrition partners from nearly 20 countries. Partners unite with a common voice and mission to introduce MMS into public health delivery platforms. As part of Nutrition for Growth's Year of Action on Nutrition, the Healthy Mothers, Healthy Babies Consortium is committed to support its current network in the introduction of MMS within the context of rigorous implementation research, emergency settings, or tuberculosis. Furthermore, the consortium commits to grow its network from 80 partners to 300 partners and expanding work from 19 countries to 50 countries over the next 4 years. We are very excited to extend an invitation to all who share this aim to join us in working together. Thank you very much.
Thank you very much, Klaus. Here, I would say, 3 very committed and concrete organizations and very concrete commitments. I'm looking forward to not only to Nutrition for Growth, but to capitalize on all the commitments that are made and make sure that they are happening and implemented at the country level by working together, making it possible that people can own their own future and agenda, create or further strengthen their own resilience and dignity and prosperity, because that is what it's all about. But first, making sure that women are treated equal and that their leaving women behind will be part of the past. Now we go to the closing session, and I'm quite sure that Henrietta Fore is here, still here, to hear from Fadila Gubari, who is an activist and youth leader from Yemen. Fadila Gubari, please speak up and reflect on what you have heard and tell us what you want to see different or better or whatever. The floor is yours for the next 4 or 5 minutes. 4. Fadila.
Thank you so much, Gerda, and I would like to extend my thanks to all former speakers, and actually the all commitments that they were said that they are really needed, and I am hopeful actually it's like in the future that we will see a change on the women's situation in terms of nutrition and how their future of the girls that will be more brighter than now. I would like to also comment about what Henrietta was saying about the UNICEF new commitments, especially the among the five key commitments that she said that caught my interest are two: the innovation and the listening thing, because in different countries, in different contexts, like for example, Yemen, so even among one society, there are different communities in which women suffer. So like, for example, women and girls do the home chores and do the farming work and fishing for water. And all these tasks are taken for granted. So they are invisible in terms of decision making, what to have on the table. And also they cannot bargain enough their rights for accessing food or any other rights, like to make them more valuable at their family level. However, they are only visible at the death rates. So it was shocking to find out that it's like in every 2 hours in Yemen, we lose a woman during maternity birth. And these three actually high death rates, according to the UNICEF, are because of malnutrition that women are inherited to be described of. And these women who died during labor, actually they cause a great loss at their family level as well, because women are nurturing their families. Even if they are the rules are taken for granted, they are still valuable at their families. And moreover, what to say, it's like I can argue that I wanted to say something about the girls, but because I have short time, so I will like sum it up in saying that
go on, say something about girls.
Okay, it's like nutrition in Yemen and food in general is not a right being accessed by everyone. Actually, so many families, they have to sacrifice their girls in order like to get them married at very young age, so they can like be able to access some food in that new house. So, but these girls are normally underage and they go to suffer as much as their parents already were suffering in terms of accessing to food, because they are already malnutritioned, and they will have to have their reproductive role. So once they are in labor or in pregnancy, they also like inherit actually the babies inside them with the malnutrition that they already suffer from. So it's either they pass away during labor, or their babies are being born underweight or maybe with acute malnutrition. So they keep suffering for 2 or maybe 1 year or two, from like 2 months to 1 year with this malnutrition baby. And this causes a lot of time loss from the girls' time as well. So I can argue that if girls had access to parent nutrition meal, either at their family's house or by any means, so they can manage to break this vicious cycle of both invisibility or sad visibility. So they can finally be healthy and visible at school classes, and they can also like contribute to the society and make this positive contribution to their society, and maybe help in updating or changing this misconception about nutrition. And I would like also to highlight that women are not pushed out from the table, but what's served on the table maybe are not sufficient for them, because women have different needs, because they are assigned with different values. Among them, it's the reproduction, so in which that they are required to have access to different type of vitamins. So I kind of agree with some of the suggestions about the fortification of the food, but I would like to stress on that there is a need to know what are the health diets or styles in different countries, so the fortification can be done for the right food that is really consumed in different communities. So for example, in Yemen, women can live with bread and tea all the day, and they do all the house chore, the farming and everything, with only like sustaining by one meal. It could be bread and tea. I don't encourage that women continue taking only bread and tea. So they need to access to other type of meals in which that they can get the right vitamins and nutrition to their bodies, so they can live longer and prosper. But how to do that, especially with the poverty and the war is turning out the country. So far, I would say even the two governments that Yemen has would agree globally or buy in or with the plans that are being published by the international organizations. They cannot do them by themselves. But
now I need to ask you to finalize, because I'm quite sure you can go on for another 30 minutes. And it is fabulous to listen to you, and crucial, of course. But one final sentence, please.
I would stress on awareness. That awareness is really, really important, because not so many people in my community that they know about the importance of the nutritious food, and also not to exclude the men who are mainly the decision makers and the breadwinners in the families, so they have to buy in. So I would say that awareness shall be addressing both, all the family members. Thank you.
Okay. Thank you so much. And now we go to Saskia Ozendarp, and she will have only 2 minutes to speak.
Yes, but thanks, Fadila, also for me, because your words are always so inspiring and really a great reminder for all of us what's really at stake on the ground, and why it's so urgent that we make transformative commitments next week at Nutrition for Growth to help power women such as yourself and the generation of women in countries such as Yemen. And I think in this sense, it was encouraging to see in this session the many new commitments that represented here today, and to really see this shared sense of urgency and momentum actually to make a real difference and to do things differently for women nutrition. And I've never really seen that before. I think it's also important to realize that these new bold commitments really need to lead to actions and to also come with new ways of working together, because the lack of progress we have seen demands us to regroup, rethink, and activate a new agenda on women's nutrition. And at the Micronutrients Forum, we are committed to bring groups together and contribute to a world where micronutrient security is available for all women. And we do this by convening and by building consensus and driving collective action, and also by supporting some of the consortia that were presented in the session here today, the Anemia Alliance, the Healthy Mothers, Healthy Babies Consortium, and a Data Alliance, because yes, Fadila, we need to know what is happening on the ground and what women eat, and in order to make effective interventions. And we know that we need better data on micronutrients and micronutrient interventions and on women nutrition. So we strongly believe that by bringing together various communities in nutrition and beyond nutrition, who at times may have disparate voices and disparate views, but we will be able to build a common ground and to achieve consensus and to collectively really make sure that we drive this women nutrition agenda forward, because we all share this passion that it's not yet too late. And I also refuse to accept that it's too late, or that we need to change our goals by 2030. No, we can still achieve our goals if we act now and if we really work together now. So I personally look really forward to support and empower the great work of the organizations and the countries that were present here today and that are active in this space as we move forward to a more promising future for women. So thank you. Gerda, over to you.
Thank you very much, Saskia, and for summarizing a little bit more to give Fadila a little bit more space. Next time we should start with young women leaders like Fadila in order to set the scene. And I think listening. It starts with listening and then coming together on the action that can be owned by girls, by women, by families, by communities, etc. Great commitments, no time because there are too many commitments that need to be summarized here. And then I need to have another 16 minutes. It's not happening right now, but it's all recorded and we will hold you to account. It's about listening, it's about awareness raising, it's about inequality, creating equality and equity, recognizing girls and women for their important role in life and that they are equal human beings that need to not be pushed from the table, but invited to the table, taking care of their specific needs as well. With this, I would like to say thank you to the organizer, the organizing organizations. Thank you for organizing this as part of N4G. Thank you for the very concrete commitments. It was really an empowering event, empowering women, starting with girls, for more promising futures. We don't give in targets and objectives and ambitions. We double down on them by working together at the country level so that the solutions that will be found and implemented can be owned and scaled up by people themselves and are built in policies and systems. Thank you all. Have a great day. And we're looking forward to making this happen. The meeting is closed.
Bye-bye. Thank you.
Thank you.